The UK relies on a complex food system linking production and consumption from farm to fork, but that system is in crisis. The food system contributes to climate change, to biodiversity loss, and to public health challenges such as the obesity crisis. All of these interlinked problems suggest that we need to transform the UK food system.
The Transforming the UK Food Systems programme secured funding to work with all of the people that are part of a food system to see how we might transform that system. The H3 project was funded because it was distinctive. Starting with the bottom up, it looked at creating a healthy soil system through regenerative agriculture. It then looked at trying to create healthy foods by using things like hydroponics. And then finally it focused on aspects of healthy people. So for instance, working with school food programmes.
In the UK, chemically intensive agriculture is degrading our soils. They've got reduced productive capacity, they've got low organic matter, and they've got reduced resilience to climate change. There's an urgent need now to be able to produce food in a way that's economically viable for farmers and environmentally friendly, as well as producing nutritious, quality food for people. Regenerative agriculture is a farming system that aims to promote soil health while promoting biodiversity and improving the long-term sustainability of farming systems and economics for farmers through reduced input costs and increased margins. During the H3 project, we've shown that changes in soil management can promote transformations in soil health that lead to wider benefits for the natural environment. When the soil health improves, we have more biologically active soil and more creepy crawlies, which then feeds birds and other organisms that promote pest control services for farmers. Increased biodiversity can come at the cost of decreased yields, but those decreased yields aren't universal, and for farmers that are farming regeneratively and using less inputs, those decreased yields might not mean a decrease in overall margins or profits. And in reality, we need to be moving away from a model that prioritizes quantity of food to one that is prioritizing producing reliable, consistent, sustainable, quality food.
The food system and food production are ever evolving. With the increased uptake of things like local nature recovery, regenerative agricultural practices, and climate uncertainty, protected growing systems like hydroponics present us with an opportunity for year-long growing and to exploit assets such as dilapidated buildings and greenhouses. But are they technically feasible, and will the consumer accept them? Here at Norton Nurseries, we've installed one such low input system, looking at nutrient provenance. We're making our own local nutrient solutions, keeping imported mineral fertilizers away, and where possible, we're keeping it organic. Also, while we're at a community garden, we're asking people what they think. Can they tell the difference between nutrient sources, and will being exposed to systems like this help them understand and accept the products?
We're in a cost of living crisis. People need to eat healthily, but it's becoming harder and harder to do that. This is impacting on people's health, and it's also impacting on our NHS.
One of the problems that we have is that people actually find it really hard to meet their recommended fibre intake, which is 30 grams a day for adults and about 15 grams a day for children and adolescents. What we give children for breakfast sets them up for habits throughout life. So we've worked with a company called Jacksons of Yorkshire, who have very high fibre breads, and we've been able to show that children will accept and will like those breads when consumed regularly. We've also developed a H3 bagel, which is a higher fibre bagel. That's a really acceptable breakfast for children and adolescents because it's grab and go, it's easy to eat, and they all like it.
We've found if we just tell people to increase their fibre intake or try to give them information on why they should increase fibre intake, it's not very effective. So we're partnering with grassroots charities who work within the community to teach members of the community how to cook high fibre recipes. We will assess their dietary intake as well as their confidence in cooking and their cooking skills to check for any lasting impact on what they eat and how they cook.
Pulses, things like lentils, chickpeas and beans, they're great for our diets. The environmental and health experts are all telling us we need to eat more of these foods. They're good for the planet, they're good for your gut, they're good for your wallet. A lot of people don't actually know what to do with lentils or beans, so we're trying to solve that problem by creating recipe sheets that can be used in community cooking classes, all sorts of resources that are free to download from the H3 website.
If we can find familiar recipes that can be adapted to be higher fibre, then people are much more likely to accept them. At Leeds University, we've worked with the catering service to do exactly that, to take a very familiar, very popular dish and replace 30% of the meat in that beef lasagna with lentils. And they've actually increased sales and consumption with very favourable feedback.
Food system transformation is often thought of in terms of what is technically possible or most efficient, but our research shows that people's diets are shaped by social conventions and institutions, often in tandem. We see this in debates around the protein transition. Recent years have seen significant technical advancements around alternative proteins, precision fermentation, and cellular agriculture. But if these foods don't align with people's identities and values, they're likely to be resisted and lead to backlash. We need to think about the social and cultural forces at play in shaping what and how people eat.
Our team explored how to change society and create a food system that is long-term resilient. The resilience literature is biased towards responses to COVID-19 that we call shallow, because they often aim at recovering the established system, when what is needed is deep systemic change to tackle climate change, biodiversity decline, and poverty. Resilience requires strong regulation and support for technology that reduces chemical inputs, local and seasonal supply, public procurement, people growing more of their own food, and last not least, social policy to eliminate poverty. So to transform the food system, we also need to change the unsustainable economic system it's embedded in.
Projects in our programme, like H3, have made incredible progress. However, we aren't there yet, and after decades of the previous system, it's going to take a few years yet to ensure that in the UK, everybody will have a healthier diet and live in a healthier environment.
We're really proud of what we've achieved over the last 5 years on the H3 project in terms of both the environmental and social science, which are leading to tangible differences on the ground. The current government food strategy is a real opportunity to put some of our ideas into policy and practice where they'll make a real difference.